COVID-19 press briefing. I am happy to be joined today by Commissioner Tracy Brown, Dr. Esteban Ramirez from the Purdue Health Center, Dr. Jim Bean from IU Arnett, Lafayette Mayor Tony Wazworski, and West Lafayette Mayor John Dennis. I will begin, as we usually do, with a review of our local COVID-19 data. Just to review, the 5 data points that the health department has been following during this pandemic are the number of new confirmed COVID-19 cases, the percentage of COVID-19 tests that are positive, this is the percent positivity, the number of COVID-19 hospitalizations, including the number of patients in the intensive care unit and on ventilators, the number of emergency department visits for respiratory illnesses, and the number of deaths due to COVID-19. This slide shows our cumulative case data for the county. As of today, we have had over 4,800 cases of COVID-19 confirmed here in Tippecanoe County. Of note, in the last 28 days, we've had 1,902 cases, and in the last 7 days, 718 new cases in the past week. Just over 2,400 patients have recovered. We've had 17 deaths, leaving 2,346 active cases of COVID-19 in Tippecanoe County. This slide shows our daily new case count for COVID-19, dating all the way back to the beginning of the pandemic. As you can see, the trajectory is heading upwards. We've had some very high case days with cases well over 100 new cases in a day, and that includes yesterday with 128 new cases. This next slide shows the average number of new cases of COVID-19, daily new cases by week. Again, this curve looks the same as the previous one, with a significant increase in our average daily number of cases, currently sitting at 90 cases on average per day for this week. This slide summarizes our local testing data. We have tested nearly 67,000 individuals in Tippecanoe County since the beginning of the pandemic. In the last week, we've tested 2,479 individuals. We have a current cumulative percent positivity for unique individuals of 7.2%. This matches the percent positivity for the nation as a whole at 7.1%. and is lower than the percent positivity for the state of Indiana, which is 11% cumulatively and 16.7% for the week of October 22nd through October 28th. This next slide shows the trends in our percent positivity going back to the beginning of May. As you can see here in the last several weeks, our percent positivity has been increasing to its current level of 7.2%. Our goal is to have this number at 5% or below, so this number is heading upwards and in the wrong direction. This slide shows our COVID-19 hospitalizations, combined data for both of our local hospitals. These are the peak numbers per week. As you can see, we've had a very significant increase in the number of patients hospitalized due to COVID-19, currently 46 as a peak number in the hospital, with 14 in the intensive care unit and 4 on ventilators. So certainly a concerning trend in terms of hospitalization for COVID-19. This slide shows our emergency department visits for respiratory illnesses, and this number has remained fairly high, fairly steady at 194 ER visits combined, again, for both hospitals. And our last slide is a updated summary of our local school data. This is congregate data for all schools and school systems in Tippecanoe County as of October 28th, so 1 week ago. 124 confirmed cases, 109 students, 14 staff, and 1 student teacher, and resulting in nearly 2,000 close contacts quarantined. So as we can see, many of our data indicators are increasing and heading in an unfavorable direction. Because of this, the State Department of Health has moved our county from a yellow status to an orange status on their county metrics map on the Indiana State Department of Health dashboard. This status is based on our number of new cases per 100,000 people and also our increasing percent positivity. What we have observed here in Tippecanoe County is generalized community spread of COVID-19. There have not been any significant clusters or groupings that have been significant drivers in this increase. Instead, it's been a generalized community spread. Of note, the proportion of our cases that are attributable to Purdue has been decreasing, and so we're seeing a higher proportion of cases outside of the Purdue University community. So for these reasons, it's more important than ever that we continue to wear our face coverings, continue to practice social distancing, wash our hands frequently, stay at home when we're sick, and avoid crowds. Smaller is safer when it comes to crowds. Along the lines of crowds, today our social gathering order takes effect in Tippecanoe County. The Health Department is advising caution and careful planning for gatherings of any size involving people from separate households, and this includes small gatherings. For gatherings involving more than 100 individuals, a plan must be submitted to the Health Department for approval within 7 days prior to the event to ensure that appropriate safety measures and prevention measures are in place in terms of COVID-19 prevention. In addition, the Health Department has updated its business recommendations and checklist of measures that area businesses should be taking to help prevent the spread of COVID-19 in their workplaces. This document can be found on the Tippecanoe County Health Department website. With our increasing numbers both here in our county and throughout the state, it is very important that we all resist pandemic fatigue. We need to stay in the race. This is a marathon and not a sprint. For those of you who have been wearing your face coverings, practicing social distancing, and doing all of the preventive measures that we have been discussing, thank you. We truly appreciate your efforts. For those of you who may not be doing such things, please strive to do better. These measures help protect yourself, your family and friends, and the community. These are the best tools we have right now for fighting COVID-19 in our community. That concludes all of my remarks for today. I'd like to turn the floor over to questions from the media and from our Facebook Live audience. Thank you.
For West Lafayette Mayor and for Purdue and also for Dr. Adler, I know at City Council they came up and asked about Breakfast Club that actually was happening also on a non-football game day. Are you seeing any of that influence, even though the percentage of the cases in the county is going down? Are you seeing any of that kind of influence? And what's going to happen? Are there going to be recommendations about that kind of activity, even though it's not a crowd, a social gathering crowd that would fit under the health order?
I'll go first. Traditionally, Breakfast Club has never been something that was organized. It's been pretty spontaneous, and generally it's been done as a precursor to a home football game. The components that have been contributing to it most recently probably has a lot to do with COVID fatigue. You know, I know that a lot of our students are getting tired of being locked up and not being able to socialize. And to that point, it seems that as a population, we've been doing really good in structured environments. You know, when we go to work, when we do things that are in sanctioned, whether they be sanctioned locations or, you know, sanctioned activities, we do well. It's how we play that gets us in trouble. And that applies towards college students probably times 10. We all know that if there's an opportunity to be together, college students are going to get together. We've encouraged mask wearing, we've encouraged social distancing, but as was seen both on television and in the newspaper, we've fallen a little bit short. As President Daniels said, this was not one of our most proud moments. But the good news is that when given the appropriate guidance, there is some form of authority there, they do comply. The other thing is the businesses are acutely aware that should this continue to spread, their businesses will be in jeopardy. The potential is that, and again, I'm not trying to speak for our healthcare professionals here, but we might end up going back to where we once started to get this under control. Nobody wants to see that. The other thing is that we're looking at ways, should we get back to a closer format of normalcy, to spread the crowds out. One of the hypotheticals that we're exploring is having a dedicated large open space, possibly the parking lot at the top of the hill there in downtown West Lafayette, something to that effect. To that way, we could establish some areas where social distancing would be mandated. We could establish tabletops, things of that nature, so that we would have a little bit more support in making sure that things are done with the proper precautions in place, and there would be a much more structured environment. The other thing is just by making sure that we have enough enforcement personnel there. You know, we had police officers there. We have our NRT, our neighborhood resource team, that's active, more specifically in the neighborhoods, but they also do drive-bys to make sure that people are distancing. And the good and bad news about that is that when there's an enforcement authority within view, people separate. But as soon as they go around the corner and they're gone, they get back together again. So the learning curve isn't an excuse anymore. Everybody's aware of what they should be doing. Now it's just a matter of encouraging compliance, whether it be through some enforcement mechanism or by actually physically designing things in a larger space to where that type of interactivity won't occur.
I can go next.
Oh, sure, go ahead.
At Purdue, we have an opportunity to review the contact tracing reports and try to see where a lot of our individuals are getting exposed to an infectious individual. We have not seen that particular event was a source, but in all fairness, it can take 2 to 14 days, and I believe we're still only about day 10 maybe from that, and so it would be within reason that we could still see it in the next 4 to 5 days. So I can't say with certainty that we won't see a bump from that. And as we've seen throughout the United States and in our state, there is an increase going on in our positive cases, but it's very difficult to tease out, is that the source or is it from something else? But I can tell you that there remains no spread on the classrooms. There is no spread in the research labs, which is great. We continue to look for that aggressively every single day in our data. And we don't have any evidence of that, but I have not had any particular cases that stem from that particular activity that weekend.
Yes. Thank you. From the health department standpoint, our restaurant inspectors did visit each of the Breakfast Club bar establishments to speak with the managers and to review the local restaurant and bar restrictions, and to also discuss ways to manage crowds, lines, outdoor crowds and lines, so as to improve social distancing, improve compliance with face coverings, and really try to create as safe as an environment as possible. Just to echo what Dr. Ramirez had said, it's important to remember that the incubation period for COVID-19 can be up to 14 days, so it's possible we'll still see some effects from Breakfast Club activities. We have, however, seen some cases arise through contact tracing. We've been able to determine arise through some football watching parties. So there's a definite risk of COVID-19 transmission even in smaller social gatherings such as a football watch party.
This one's for Dr. Ramirez. Just wanted to know how many of Purdue's most recent cases have come from the Greek and co-op houses, and how many of those houses are under any kind of quarantine?
Absolutely. So we continue to see about 50 to 60% of our cases primarily coming from congregate living situations or in association with the membership. And that we're seeing not only out off campus, but we're also seeing with the new membership, we're seeing some in the dorms now too. And so what's good is we're identifying those individuals quickly and managing that and moving them appropriately to isolation space. But that has alerted us to doing some different type of testing, using the data to kind of help us to figure out where should we test more so that we can find out if there are exposed individuals who are infectious, that we identify them early so that we can get them in the right place and keep that area as safe as possible.
How many are on lockdown?
Oh, thank you. 3 houses are in large-scale quarantine currently. And we have, I believe the last number was, let's see, through the 20, 28, 29 were in small scale, which means 1 or 2 positives in the house, or one or two quarantining, sorry, with an associated positive.
Question from Allie Kirkman with Journal and Courier. With the trends going in the wrong direction, do you anticipate that K through 12 schools need to switch back to remote or e-learning? And what is the health department's recommending to administrators at this point with instruction?
That's an excellent question, and certainly we're watching our school data closely. Thus far, when you consider how many K through 12 students we have in our county, we haven't done too badly in terms of our local schools. Clearly, there are a lot of students who end up being quarantined, but one way to look at that is by quarantining those students. That's one of the ways we've been able to keep our numbers of cases within K through 12 students as low as it has been. Certainly watching those numbers closely, and you know, if the data continues to trend in the wrong direction, you know, there's always a possibility of modifying our school arrangements, but we're still watching our data at this point.
Question from Facebook Live. Is contact tracing still useful with such a high positivity rate and community spread? And is there any concern about testing capacity?
Yes, contact tracing is still useful because identifying close contacts and having them in quarantine is one of our best tools to slow the spread of COVID-19 until we have a vaccine. And it becomes even more important as our numbers and our percent positivity increase. And I believe there was a second part of that question that I may have left out.
Testing capacity, are we worried?
Sure. We're fortunate in our community to have really pretty good testing capacity between our 2 hospitals and between our State Department of Health Optum testing site. In addition, right now we have an additional testing site through the end of this week, I believe, at the White Horse Christian Center in West Lafayette. That's also a State Department of Health testing site, so it provides free testing without a doctor's order. One of the things that we have heard, though, from our testing sites is that because of the number of tests, it is taking a little longer to get the results back. So whereas it used to be 24 to 48 hours, sometimes it is longer than 48 hours, which is unfortunate, but with the volume of testing, it's something that has occurred.
Have you made any calls about what advice or any kind of restrictions you're going to make about Thanksgiving and the other holidays coming up?
You know, at this point, our main message to folks is that social gatherings of any size involving people from separate households do carry a risk with them. And so that would include smaller gatherings for the holidays. And so our mantra is the smaller the gathering, the better. And we would ask that families and other groups keep that in mind as they make their holiday plans. And that may mean the holidays may look a little different this year, particularly if you have individuals in your extended family or group that are in a higher risk category. You really need to approach these holiday gatherings with caution and careful planning.
Again, for Dr. Ramirez, what is Purdue looking at or planning for now that we're getting closer to the Christmas, Thanksgiving long break? What's the plan there as we get closer to that?
Absolutely. So we're going to continue to have our case managers available. So Protect Purdue Health Center is going to remain open 24/7. So we are going to have, we're still calculating or getting the survey results back on how many people are actually going to stay on campus after Thanksgiving. But we're going to, of course, ramp up accordingly to make sure that we have enough staffing to handle that. But like I mentioned, we're 24/7, so we'll still be available to do any case management or contact tracing for anyone that is still on at the university properties. We still will have isolation space that's open, and we'll be monitoring that as we currently do. And our quarantine, I actually think it'll be a little easier to quarantine because it's de-densified. So depending on where the individual lives, they might be able to stay in place or move to the isolation space.
For Dr. Adler, are most of our cases still in the 20 to 30 age range, or because you said it's kind of becoming more community spread, are we seeing an increase in any of the other age ranges?
Yes. Yes, we still have a lot of cases in the 20 to 29 age range, but we're seeing an increase in cases in other age groups, and we're seeing, interestingly, an increase in cases involving older adults, so adults over the age of 50, and not necessarily individuals in that age range who live in long-term care facilities. They're living in the community. So that's caught our attention, and we're watching that very closely.
For the hospitals, with the numbers going up, 2 weeks ago you were talking about already being full. What's the situation now for you?
Sure. So we continue to be under extreme pressure for inpatient beds and have been at or near capacity since the last time we gathered. So that really hasn't changed. As you saw in the graph, the number of COVID positive patients being cared for in the local hospitals has also increased and is at a peak for our experience. We are starting to use, I would say, atypical spaces in the hospital to find ways to care for more patients and ease our backup challenges in the emergency department. So that's a new challenge for us that we're experiencing almost on a daily basis now. So the hospitals, in summary, are under consistent pressure for adult inpatient beds. We're using our regional smaller hospitals for our UHealth Arnett up in Monticello and at Frankfurt as pop-off valves, if you will, to send appropriate patients to those facilities to be cared for by the great teams that are in both of those facilities, but who otherwise would have been cared for in Lafayette. And the IU Health system is using our statewide system in that way as well, to some degree. So.
Have you had to use, I'm sorry from here, but have you had to use the tents or anything like that yet for intake or for anything?
So.
Is that part of the atypical?
Yeah. So the tent that you'll see out in front of IU Health Arnett is not really a clinical area. It's more of a shelter for ambulances as they pull up, because the ambulance bay has been turned into a temporary holding area for patients. And so we have a number of hospital beds there and are able to hold patients for a period of time in that space who are going to be admitted. Thankfully, we haven't had to expand into that space. We've used it to test it and make sure that it's safe, and we've got the practices and the teamwork that we need, but it stands ready, and we anticipate that we likely will.
Question from Facebook Live. How many K-12 students that have been quarantined from a close contact have been tested positive?
How many students that have been quarantined from a close contact have tested positive? I don't have that data with me.
So as a follow-up to that, is there a way to get that data? The 1,996 close contacts being quarantined, is there a way to get that data? Just to see if you're quarantining enough or not quarantining enough, or quarantining too many?
It should be possible to get that data. Yeah.
And as a follow-up to Dr. Bean's response, so there's 46 hospitalizations of patients in the county, between the two hospitals. How many beds do we have between the two hospitals? I know Dr. Wicker told me they have 189 beds.
So there's probably more than 46 now, because it's gone up from when we met this morning. Total number of adult beds at IU Health Arnett is around 150.
So we have about 300.
But there's about, I think 297 was the number I thought was on a recent document I saw for total adult beds. Now, as I referenced, we're also using atypical space, so we're using some of our, at various times during the day, we'll be using some of our surgical space for patients that might otherwise be brought upstairs from the emergency department right away, et cetera.
So some of the limitation to healthcare professionals that are being quarantined, or is that not an issue right now? I mean, why we have 346 beds in our county and 46 have COVID patients, but we're all a little worried that we get overflowed here.
We're at capacity. I'm at 95+% capacity right now.
Patients with other problems that would have taken up the other
Oh, yeah.
130
Oh, yeah.
beds
So,
we have.
so there's heart attacks happening, there's surgeries happening. So yes, all of the baseline disease that we care for is, and all of the elective work that we care for is still happening.
So does it make sense to shut down the elective stuff again then?
So that's a question that we ask almost every day is, are we able to continue this pace? I'll also say the other thing that's putting the hospitals under pressure is illness among caregivers and illness among staff members. We're members of the community. We're exposed to this high level of community spread that everybody else is. And so not surprising that some people are getting sick or their family members are getting sick and they're needing to care for family members. And so that's an active area of concern as well.
So if somebody tests positive and has nowhere to go, do we still have hotels and motels open in the area they go to, or do they go to the emergency room and be admitted, or where do those people go? Does anybody know? Like if you test positive but you have people in your house with you and you can't isolate anywhere, is there somewhere in town where those people are sent? Like Purdue sends them to the student housing. Is there someone in town, or do they show up at the emergency room and because of lack of no other place to go, they end up being admitted to the hospital?
So the people that are getting admitted to the hospital require hospitalization. And I would strongly encourage people not to come to the emergency department unless you really need emergency medical care. There are ways of seeking phone or virtual care advice to help you make that decision. Similarly, I wouldn't discourage somebody from coming if they really thought they needed an emergency evaluation. But to clarify, people are not being admitted because they're positive unless they have a reason to be in the hospital, requiring oxygen and extra treatments, et cetera.
Yeah, I think Dr. Boleyn told me yesterday that shortness of breath should be the key to get to the emergency room right away. Is that fair to say?
Yeah,
Fever, sort of, but shortness of breath is a big deal.
and again, there's ways, there's ways to reach out and solicit feedback from a healthcare provider in real time about your current symptoms. So I would encourage people to take advantage of those opportunities.
Now that the election's over, and there's been all kinds of questions about whether there would be any kind of state mandates, are you looking for the governor to do anything more than he has already done about the reopening plan or pulling back from that? Or what are you hoping for?
Well, I think that, when you look at our data, not just locally, but also for the entire state, we have a very large number of new cases every day. I think today, again, was over 3,000 for the state of Indiana. So, I think clearly some action needs to be taken. Now, I'm not sure what action will be taken, if any. I believe the governor has a press conference today at 2:30, and we'll be watching that very closely to see if there's any change in plans for the state. But I think if you look at our data and the way things are trending for our state, it would make sense to look at some of the measures that were in place in previous back on track stages as being appropriate for this time, I think.
Question from Allie Kirkman. Is the spread of the virus in classrooms still minor at this point? Dr. Adler previously said school sports have played a bigger role and that the department has started to review plans for indoor winter sports. Is there an update with that?
Yes, I mean, we do see some spread within classrooms, but when one considers the number of students we have K through 12 in our county, I would still characterize that part of the spread as in the minor category, and there have been, of course, some spread through sports. We're watching that closely, though. That could change, as there's more cases in the community. That's definitely definitely would increase the likelihood of a student or students or teachers or staff picking up the virus elsewhere, bringing it into the school, and then it could spread that way.
And following up on the governor's plan for the mayors and for Commissioner Brown, what concerns do you have if things are scaled back? And do you agree with the approach that the health department's, hoping for some kind of pullback right now?
Well, in one degree, we're fortunate because our population shrinks significantly around the holidays, or towards the end of this month, actually. So that provides us a little bit of a buffer. But one thing we've learned is that these decisions aren't made sort of haphazardly. If the governor decides to go back to 4 or 3 or whatever the choice may be, there's a reason for it. And as we did with the first blush, at least I speak specifically for West Lafayette, we will comply.
I guess, I've been on record before when asked this question about being in alignment with what the governor and the rest of the state of Indiana is doing, and I still feel it's important that we maintain that alignment. And I think that everything that we do should be evidence-based. We should be looking, if the question always comes up about restaurants and bars and things of that nature, if the state's going to do something with that, again, I hope that that's based on hard numbers that we're seeing or clusters identified in communities. Again, I would encourage everyone to wear a mask. It is a simple thing to do. We are used to it now, and that is still one of our greatest assets. That and social distancing. We just need to continue to take that seriously.
I would concur with what Mayor Dennis said. We've got a lot of things to watch, and we got some real changes in the community coming up in the next couple weeks. So certainly all those things will need to be taken into account, and I will be interested to see what the governor does say today also. But certainly we have to continue to monitor closely our data, our science, what the hospitals are going through, and make sure that we're making good decisions for the public health and also keeping an eye on our economy. And as we always have been, continuing to find that balance here in the community.
Just one last thing. If we go to red next week, should we expect some kind of more restrictions locally?
Well, hopefully we won't go to red. But as I've said, before in previous press conferences, additional restrictions are always on the table. We don't want to have to do that, but if the data leads us in that direction, we may not have a choice. Likewise, if the data improves, we would gladly pull back on restrictions. So it's just so important, just as Mayor Rosworski and Commissioner Brown were saying, it's just so important that all of us do the things we've been talking about now for months, and wearing those face coverings and social distancing and trying to avoid crowds and staying home when we're sick. These are the things that are going to help keep our situation under control here and maybe hopefully reverse the trend that we're seeing and keep us out of the red zone. It'd be nice to go back to yellow or even to blue.
Question from Facebook Live. What is the likelihood of getting COVID for a second time?
Oh, yeah, that's a great question. And I don't know if the percentage has been determined yet on that. There have been some reports of people being reinfected with COVID. Perhaps Dr. Ramirez or Dr. Bean may have some additional information about that.
Yeah, there have been a few reported cases, just really a handful at this time, but I think we don't know percentages yet. But of course, that's something that we're all really interested in learning more about, because that will play into what the next couple months look like.
I'll just say my colleagues are very smart.
Yes, they certainly are. Just a question, the Abbott $5 card, the Bionics Now card that the government's announced that they're sending $150 million to the different states and public schools and all that. Have they arrived here yet, or we do know anything about those? Do we have those?
As far as I know, they have not arrived yet for our local schools. Our long-term care facilities have been using something like that for a while now, but they have not arrived for the local schools.
It's just referencing an article in the Journal and Courier on October 20th that the federal government had shipped more than 100 million of the new rapid tests to states for use in public schools, assisted living, and other testing sites. So is it something you can look into to improve the testing options that you have out there, and as a way to surveillance people rather than waiting for a PCR test to come back a day or 2 or 3 later?
The state is still waiting on those. I have contacted state about congregate settings such as the jail and our Lafayette Transitional Housing, and the state is still not sent them to all the nursing long-term care facilities, and we're still waiting to receive those from the federal government.
Thank you.
Question from Facebook Live. Would it be possible to get an aggregate number for flu vaccination rates?
It should be. I think we should be able to get that sort of information. Yeah. Well, if there are no further questions, thank you all for attending.